Welcome to Sky Women. I'm your host, Dr. Carolyn Moyers, a wife, mom, and board-certified OBGYN. This is a place to educate, empower, and inspire. Join us each week as we share the power of women's stories. Real women, real stories, real inspiration. Put on your stretchy pants. Let's get going. Welcome, Sky community. Welcome back to another episode of Sky Women Podcast. We have with us today Dr. V. She is board certified in gastroenterology, hepatology, and nutrition. She completed her fellowship at Johns Hopkins University Hospital in Baltimore, Maryland, and she now resides in Houston. She is doing all the things in private practice. Most of her patients refer to her as Dr. V, but please tell me how we pronounce your name properly.
Oh, hey, Sky community. Very nice to be here, Dr. Moyers.
Yes.
Thank you very much for having me on, and it's a pleasure to be with the Sky community. My last name is pronounced Asamoah.
Asamoah. It's beautiful.
Thank you.
All right. Dr. V is affectionately called Dr. V by her patients. She's well known for her private practice Facebook community and YouTube channel called Natural Gut Relief. Welcome. We're so happy to have you today.
Thank you. Thank you so much.
This is an important month for you to be here as well. Want to fill everybody in why?
It is. March is Colorectal Cancer Awareness Month, which is really important for us as gastroenterologists because I think 70% of our work is done around prevention, and that is prevention of colorectal cancers through screening colonoscopies for the most part. So we do a lot of community events, a lot of social media outreach to make sure that the patients that need to get screened, who are high risk, and also those that need to start getting screened, which is now age 45, are getting screened as soon as possible.
Yeah, absolutely. I love that you bring that up because I think that's a really important fact for women to know that screening begins at 45. And colorectal cancer screening, colonoscopy is kind of the gold standard, right?
It is truly the gold standard. I mean, we encourage any form of screening, but I think that when you're 45 and this is your first one, you want to do it right. You want to get at least whatever information you have. Do you have tiny little polyps? Do you need to come back in 3 years or 5 years? Now, the other tests are not going to pick that up. Only the colonoscopy will. So it is preventative and diagnostic in many ways.
Perfect. And so how often are most individuals who screen negative required to get their colonoscopy?
So if you screen negative and there's no family history of colon cancer or colon polyps, then every 10 years. I do encourage for our patients who are slightly higher risk, so family history, I put in that category also African-American patients, Black patients, slightly higher risk, to try and get screened every 5 years if possible. Mm-hmm.
Okay. And so if somebody has a family history of colon cancer, do they need to screen earlier?
They typically should, right? Because guys, remember that the age for screening up to 3 years ago was 50. And that age has been, dialed back to 45. Mm-hmm. The reason being we're seeing such a high incidence of colorectal cancer in people between the age of 35 and 50. Right. And so if you do have a family history in the past, we would say, well, start your screening 10 years before the age of diagnosis of that family member. So if it was a sister and she was diagnosed at 50, we would say start at 40. And so that's what we typically do. So our patients with a family history get screened earlier as well.
Perfect. Okay. So that is really important for us to all be aware of because so often as women, I feel like that we really put off what's going on with our GI system. I'm just bloating, or, it's my time of the month, or, I'm just constipated. Maybe I didn't drink enough water, and we're constantly go, taking care of everybody else. And so it's easy to just kind of dismiss these symptoms, right?
100%. I think that is so true. Women are often so busy doing so many other things that we do dismiss our symptoms. I mean, my husband had like a little elbow thing and I haven't stopped hearing about it for a whole week, right? He got a brace that looks like a bra. And I'm like, what's going on here? Every day he's wearing this brace. And I'm like, you know what? I think I have tummy pain, leg pain, and shoulder pain right now, but I'm not complaining, right? So we do have a super high tolerance. And sometimes we we put others first, right? We put others first before us. And then I think there's this concept that colon cancer only happens to men. I don't know. A lot of women are like, does it apply to me? So it's not the prostate. This is the colon. Both men and women have one. Both of us need to get screened, same age, 45.
Right.
Yeah,
absolutely. So what are some of the symptoms that patients need to look out for if they needed to land in your office sooner or with concern?
Okay. So the first and foremost, we don't want you to have symptoms. We want you to make sure you're getting that screening at 45 because it's preventative and it's fully covered by your insurance. Most insurance plans will honor that. So it's always good to double check. By the time you have symptoms, it could be pretty bad, right? It could be pretty advanced, but it's still important to get checked and screened quickly. So any change in your bowel habits, like, you usually always had regular stools and now you're constipated, or now you're having diarrhea and not having stools for several days, right? Bowel movements, any rectal bleeding. There was a time where people would have rectal bleeding and were like, it's just hemorrhoids, just use this cream and you'll be okay. Mm-hmm. At this point, given the incidence of colorectal cancer, any rectal bleeding is concerning. So we're going into scope. And then abdominal pain, just having kind of this weird abdominal pain and bloated sensation, it may be important to get screened. So at least see your doctor and talk about it.
Mm-hmm. Yeah, absolutely. Absolutely. And I think it's important for patients to advocate for themselves if they feel like they're being dismissed and they're like, my gut's telling me something's really wrong. Go see the gastroenterologist.
Listen to your gut. Listen to your gut. Yes.
Well, and I know that you believe in that a lot with your functional medicine piece that you add. So let's talk a little bit about diet and fiber.
So, yes. So, we were talking about constipation, Dr. Moyers, right? And that it's a common symptom, but when there's a change, it could mean that there's something else going on. But we kind of concluded, the two of us together in our conversation before we jumped on, that the American population is really deficient in fiber. We just don't eat enough of it because so much of our food is so processed. Right? So much of it is processed. So much of it is devoid of nutrients. Mm-hmm. And so fiber is the number one key thing. And we often don't realize how little we're getting. I was talking to a dietitian friend and she was like, Obi, just tell your patients 2 servings of fruits and vegetables at every meal. And I was like, I don't think I'm not doing that. I'm like, I think I had a bagel on my way out. It was a power bagel, but there were no. So when you have that in mind, 2 servings of fruits and vegetables at every meal, you have to intentionally make an effort to add that. Did I have my fruits? Can I throw in a vegetable somewhere? Can I throw in flaxseed and chia seeds into my smoothies? And as women are supposed to eat on average 25 to 30 grams of fiber daily. Mm-hmm. Keep in mind that an apple has 3 grams. So that would be like 30 apples. And a serving of blueberries has like 8 grams. So you kind of want to really kind of consciously make an effort when you're shopping to pick high fiber foods that you enjoy and you can add to your meal. Men need about 35 grams of fiber, so even more. And so we're just not getting enough fiber and the diet isn't pushing it. And this applies to our children too. So really, the solution is fiber, fiber, fiber. When it comes to diet and nutrition, not just for bowel movements, but fiber is also a prebiotic that feeds our gut microbiome, right? And we know the gut microbiome is so important. We're finding that, issues with the gut microbiome could affect mood, anxiety, depression, skin issues. And so making sure that you're doing your part to enrich in your gut microbiome is super important. So fiber is the word. It's the it word, fiber, fiber, fiber.
So I have a question about that because I have an acquaintance who does a lot of training and doesn't believe that fiber really is important. And I very much disagree with the amount of protein that we're asked to consume when training and not placing importance on fiber because that leads to a lot of constipation.
Oh, yes, yes. So, I would like to meet this person because, I have seen stool microbiome studies of patients who are on a balanced Mediterranean diet, beautiful microbiome, doing things like we call the low FODMAP, where you have to restrict certain foods because of bloating, poor microbiome, and then the ketogenic diet, that's high protein, high fat, poor microbiome. So I think the goal in everything and in life, I think, Dr. Moyers, it's all about balance.
Yeah.
It's all about balance. You need a bit of everything, but fiber and foods that are rich in plant-based fiber, very important for the gut.
Yeah. And as you said, there is a connection from the gut microbiome to our brain health.
Absolutely.
Dr. Amy Shaw just wrote a fantastic book called I'm So Effing Hungry. Have you read this?
No, I haven't.
But she's talking, you're going to have to read it. She's talking about that. Her other book is I'm So Effing Tired, which also is good. It was the first place I've ever seen the hormone health, gut health, and immune health kind of brought together.
Connected, yes.
Yeah. So that's a fabulous book, a fabulous resource. Okay. So we talked about colorectal screening. We talked about the importance of fiber in our diet. Let's talk about constipation and just women often have constipation and they think that this is just normal. So when do they need to be concerned and really what can they do about it? Because as we've identified, a lot of the times it is just our lifestyle and what we're not doing for ourselves.
It can be. I think women are unfortunately blessed in many things, but those hormones sometimes help us and they hurt us at the same time, right? And so I think there's a lot of hormonal involvement when it comes to the movement of the gut, which we see the motility of the gut. And I think when we as a female gastroenterologist, I would see like maybe 70% of my patients are women. And one of the top complaints, of the top 3 complaints in my practice is constipation. It's constipation. And our gastroenterology, journals define constipation as someone who has less than 3 bowel movements a week, someone who has hard pebble-like stools, and then someone who has issues pushing the stool out, like evacuation, like a sense of complete evacuation. So it is all of these things, right? You could be going every day, but it's like tiny little pebbles. You're not clearing up. You're constipated. You're going 2-3 times a week. Constipation, or you're going and you feel like there's still stuff stuck in the rectum, that's also defined as constipation. So if you have any of those symptoms, yes, you should consult because there's a way to kind of figure out what issue is going on and how can we help? What can we do to help?
And you mentioned that there were a couple of female diagnoses that you commonly see constipation in relation to, and what were those?
Absolutely. And I think some of it may even dial back to the microbiome, right? So in our patients with endometriosis, we see a lot of IBS type symptoms and there's motility issues. Some of it hormonal, some of it post-surgical, right? Our patients with endometriosis, severe forms that have a lot of scarring in the gut, we'll see the scar tug onto the rectum, tug onto the intestines, and cause delay in motility, and that causes constipation. And patients with very large fibroids, constipation issues there. And even our patients with PCOS, right? Patients with PCOS who have this insulin resistance issues, that affects the microbiome, right? The two are very much connected, and we'll see changes in bowel movement related to that as well.
Yeah. Okay. So what is your favorite constipation or bowel regimen for somebody to avoid constipation?
So some people do well when they come in and we just like, are you drinking enough water? Are you drinking half of fluids? Are you drinking half of your body's weight? I don't know who really drinks half, but are you drinking close to half of your body's weight? And how much fiber are you getting? So we start with sort of those basic fundamentals, right? And we also look at, how they're using the restroom. What is the stress? Stress will affect the way your bowels move as well. So you'll notice that if, you're stressed out, you just don't really have the cues between brain and gut to think, oh, you know what? I'm getting the cues to have a bowel movement. So really having the time in the morning to have a bowel movement and not be rushing is important. I see a lot of school teachers who can't even use the bathroom because there are no bathroom breaks, right? So they don't have time to have a bowel movement. There's something as I don't have time to poop, which is really sad. It's really sad, but it's there. And then I think once you start like not listening to the cues, your body doesn't feel it anymore. And you're like, well, I think I can go 2 days without pooping. And your body's like, I think I can
get dysregulated.
Yeah. It dysregulates. So really listening to those cues are really, really important. So those are the top things. And then, we have to be honest too. We sometimes put patients on medications that cause constipation. And so
Right, right.
it doesn't make sense to have a patient on a medication that causes constipation and then give them a constipation medication. So I usually will say, hey, talk to your cardiologist. It's usually them, and can we switch this for something else? Can we adapt? Can we change something? So those are usually the things we start off with. And then we start working on, okay, how do we get things moving after you started that? My go-to is magnesium.
I was just going to ask you about magnesium because especially in my perimenopausal and menopausal women, I love to have them take a magnesium supplement in the evening.
Absolutely. Absolutely. And there are many different forms of magnesium, but the ones that really work nicely as a laxative, kind of like a gentle pro-motility agent, is magnesium citrate and magnesium oxide. So I'll usually start them on a low dose magnesium. I'll use this magnesium calm, which is a powder that you can take overnight that helps you with bowel movements and also helps with anxiety. So that's really helpful. So magnesium is really, really helpful.
Awesome. Yeah, I love to hear that. Okay, so we've got to talk about the pelvic floor because I am obsessed with the pelvic floor.
I get it.
And
I get it.
Too often we are not rehabbing the pelvic floor after childbirth and pelvic surgeries and all of the things that happen in the life of a woman. And that really plays a role in our bowel movements because our pelvic floor functions in our sexual pleasure, in our, going, urinating, and also our bowel movements.
Absolutely.
And holding our pelvic organs.
We forget about the pelvic floor because it's hidden. Nobody sees it, and even when you do imaging like a CAT scan, they never talk about the pelvic floor muscle. No, but I think it's often ignored. It is, and sometimes ignored for way too long. And that's when we start seeing symptoms occur. So the pelvic floor is a really important muscle that helps with contraction and relaxation of all the organs that sit right around the pelvic. So just like you mentioned, the uterus, vagina, the bladder, as well as the rectum, right, sits at the very back. And so when the pelvic floor is weakened, either from surgery or from multiple childbirth or very difficult childbirths, like difficult vaginal births, and it doesn't contract as well and it doesn't relax as well. And it gets weakened and things start kind of prolapsing down. And we develop in the rectum things like little rectal seals that we can also have in the bladder as well. Cystoseals. It's just really a prolapse. So strengthening that pelvic floor through therapy and things like biofeedback, we can see that reverse constipation or at least improve it significantly in about 75% of patients. So that's really important. Yeah.
That's awesome. So pelvic floor physical therapy is key, friends. You hear me say it all the time. We've had multiple pelvic floor physical therapists on. I have several in the community that I collaborate with. I am a big fan. Okay, what are your thoughts on the squatty potty?
I think the squatty potty works for some. I think it's basically what it does is that it gets your, that connection between the pelvic floor and the rectal entry exit in a certain angle. So it makes it easier for that pelvic floor to contract and stool to come out. And I think it works in some people, not in all, depending on what type of constipation it is. But with issues with pelvic floor dysfunction, I think it definitely does help. So I say give it a try. And it doesn't have to be the squatty potty. It could just be a little step. Right. And you're good. Yeah. But pelvic floor therapists are really, really amazing at what they do. And they find ways to help you even just understand and listen to your body really well to kind of feel through and see the signals that you may have forgotten when you need to go or when your rectum is full. So they do an amazing job.
Yeah. Awesome. Yes. One of my most common referrals, quite frankly,
to pelvic floor
in my line of work. Yeah.
Same here.
Oh my gosh. Well, this is just a wealth of information. Thank you so much for sharing with us today. Where can patients find you or listeners find you?
So I am an integrative gastroenterologist based in Houston, Texas, actually based in West Houston in a community called Katy. They can find me on social media. I'm on Facebook. I'm on Instagram. My website is drvivianasamwar.com. They can find me there. And so we also have an amazing Facebook group, a private Facebook group called Natural Gut Relief, where we focus on, helping patients with chronic GI symptoms and pain relief using natural solutions, so it's a lot of focus on diet and nutrition and hypnotherapy and gut psychotherapy and then some people just in there sharing recipes about healthy foods that help heal the gut. So you're all welcome to join.
Nice. Okay. And we'll include all those show links in the show notes. Okay. Thank you so much. It's been a pleasure. Until next week, be well.
You're so welcome. Bye.
All right, Sky community, thank you for listening to another episode. This episode was sponsored by Sky Women's Health. As a reminder, we're in the Dallas-Fort Worth area, and we help relieve back pain and pelvic pain in pregnancy and beyond. If you are pregnant and having pain and you feel like you have no reliable way to relieve it, look us up at skywomenshealth.com, request an appointment, and we'll call to get you scheduled. As a board-certified OBGYN with a Neuromusculoskeletal Medicine Fellowship, I help you realign with hands-on drug-free treatment and relieve pain on the spot without medication. We'll help you maintain these results through your pregnancy and postpartum period. Every pregnant person deserves this, and we are so excited to serve you. You can find us on our website, as mentioned, or on social at Sky Women's Health, or you can call the office at 817-915-9803. That's it for today. Until next week, be well.